Hello friends, my name is Abhirami and I am here to discuss about the popliteal artery today. So I will be talking about the origin, course, termination, the relations, branches and the clinical anatomy. So let's go back to the origin of the popliteal artery. The popliteal artery is a continuation of the femoral artery. So the popliteal artery originates in the opening in the adductor magnus muscle. It is also called as the adductor hiatus. So popliteal artery originates at the adductor hiatus. It is a continuation of the femoral artery. It courses through the back of the knee joint, and at the lower border of the popliteus muscle it terminates into anterior tibial artery and posterior tibial artery. If you look at the image there, as you can see, the popliteal artery originates from the adductor hiatus, courses through the back of the knee joint, and at the lower border of the popliteus it divides into anterior tibial and posterior tibial artery. Now let's go to the relations of the popliteal artery. The popliteal artery has anterior relations, posterior relations, medial relations and lateral relations, and also the popliteal artery is the deepest content of the popliteal fossa. So since it's the deepest content, anterior to the popliteal artery are bones. So it includes the popliteal surface of the femur and the back of the knee joint and the fascia covering the popliteus muscle. Posterior to the popliteal artery is the tibial nerve, and medial to the popliteal artery there are five contents. These are the medial condyle of femur, semimembranosus muscle, and then the tibial nerve, popliteal vein, and the medial head of the gastrocnemius muscle. The lateral relations are the lateral condyle of femur and then the biceps femoris muscle and the lateral head of the gastrocnemius muscle. Now let's go to the branches of the popliteal artery. The popliteal artery gives off 2 to 3 big muscular branches, and these supply the adductor magnus, and also it gives off some other branches in the lower part which supply the gastrocnemius, soleus and the plantaris muscle. Then the popliteal artery also gives off a cutaneous branch, accompanies the short saphenous vein. Then the popliteal artery also gives off 5 genicular branches. These 5 genicular branches are superior, lateral and medial genicular branches, inferior, medial and lateral genicular branches, and the middle genicular branch. So the middle genicular branch pierces the oblique popliteal ligament of the knee joint and it supplies the knee joint. And the rest of the 4 superior and inferior genicular branches will wind around the condyle of the femur and the tibia respectively, and they will anastomose at the front of the knee joint. The superior genicular branches will wind around the femur, and the inferior genicular branches will wind around the tibia. They will come to the front of the knee joint and they will anastomose there. So that is it about the branches of the popliteal artery. Now going to the clinical anatomy of the popliteal artery. So blood pressure can be recorded from the popliteal artery, and also the popliteal artery and also during coarctation of aorta or the narrowing of aorta, what happens is the upper limb, the brachial pressure is greater than the popliteal pressure, because blood is not being efficiently pumped to the legs. So the brachial pressure is greater than the popliteal pressure. And also since the popliteal artery is pressed against the unyielding tendon of the adductor magnus, there are chances that a gangrene may develop in the popliteal artery, but this is usually prevented by the collateral circulation through the profunda femoris artery. So there is a fibrous band that is passing over the femoral condyles, and popliteal artery passes beneath it. So the popliteal artery is fixed to the fibrous capsule by the fibrous band between the 2 condyles of the femur. So what happens is it might cause a stretching or a coarctation of the popliteal artery, and this leads to thrombosis of the popliteal artery. Thank you for listening to me. That is all about today's video. Thank you for listening to me. If you like this video, please like, share, subscribe and comment on it. Thank you.